When choosing a specialist to help solve something as debilitating as chronic foot pain, you of course want to know what exactly I should say, they can do for you. It's also comforting to know why they want to help you. So today, get a bit of the personal backstory for Dr. Vincent Staschiak with Mid-Ohio Foot and Ankle Specialist. Good to see you again, Doctor.
Same here, Robin.
Okay, so let's talk first of all about what you do. Tell us about your practice and what you offer to folks.
So I specialize in podiatry, which helps people with their foot and ankle conditions, basically the entire lower extremity, and we offer a lot of non-surgical resolutions to keep them out of surgery, off of drugs, on their feet, and help to get them pain-free.
Help to get them pain-free. And this is, as I mentioned, kind of personal to you. Tell us what sparked this. Why podiatry? Because people will ask you, right? Why did you want to look at feet all day? That's not something everybody decides to do. So
right.
What was it for you?
So for me, when I was a kid, I would notice people that had a limp, and I would always ask my mom and dad, why is that guy limping? Why is that lady limping? Why doesn't somebody help him?
Yeah.
And my mom and dad would always just pull my arm and say, don't look, don't look. And I came home one day when I was 15, I said, I know what I want to do. I want to help these people. I want to be a doctor. And my mom was like, thank you, Jesus. And my dad was like, what kind? And I said, I'm going to help these people with a limp. And he's like, you have pointed them out your entire life. So I worked 60 hours a week at General Motors convertible plant, putting myself through school, went to medical school, residency, and I've been doing this for the last 27 years.
And all those people are now thanking you, right, for getting them back. I mean, they were the impetus, the spark for your career.
You know, I never get tired of people saying thank you for helping me get my life back. And I just want to keep you going. I just want to keep you up. Play your pickleball, play your tennis, go jog, go run, go walk. Get up out of a chair without having pain.
Exactly. All right. So then all these years later, you're still as passionate about it. So I want to talk about a lot of the things that impede people's ability to move, really, right? So what are you seeing as the cause of a lot of things? Is it just age that people are facing, or what ailments?
So there's a lot of biomechanical deformities, bunions, hammer toes, flat feet, that cause you to walk improperly from the first steps that you're taking as a baby. And it just gets worse and progresses as the years go on. So even if you have a severe bunion deformity where your foot doesn't look right, a lot of people will say, well, I've never had any pain. And I tell them, well, don't do anything about it. I mean, that's the way you were born. You're used to the way it looks because the progression is so slow. Over time, you are wearing away the joints. You're pulling the muscles and tendons the wrong way. You're causing ankle sprains, damage to the articular, the bones, the soft tissues. And that's what I treat is, don't fix the deformity that you've had for 40 years. Cure the pain. Stop the pain.
And isn't that the thing where you're kind of alluding to this, is that, you know, there may be one issue that isn't a problem, so to speak, but then the snowball effect of that can be so great on somebody's quality of life.
It is, definitely.
Yeah. All right, so then let's talk about the tools that you have available. What are some of the ways that you treat, and, you know, maybe pinpoint a few of the common issues that people come in with?
Yeah. So for everybody, I tell them right off the bat, for 80% of the people, try your conservative therapy first. Go with different shoes first off. Try some. Oh, I love these. They look so nice. But they look like they're 60 years old. They are 40 years old. Try some new shoes. You might be able to resolve it that way. Try some soft inserts, some arch supports to help kind of control the movement of your feet inside of your shoes. You can try a lot of conservative options to just make your life better. But if you're one of the 20% that says, I've tried everything, I can't do anything, and you come down to either surgery or live with it, that's where I tell people, stop. You do not need surgery. With the options that I offer and I specialize in over the last 27 years, orthotripsy being one of them, which is a one-time treatment for plantar fasciitis or Achilles tendonitis. It puts you on the road to recovery and you just keep getting better every day until the pain is totally gone. Or regenerative medicine. I love regenerative medicine. I've been doing that for 27 years as well. Stem cell therapy. That can rebuild an entire joint, repair muscles, repair ligaments, rotator. I have a rotator cuff tear. As long as it's less than 40%, one shot of steroids, or not steroids, because that's just an internal temporary Band-Aid, stem cells can repair that entire muscle tear.
I feel like a lot of people come to you too specifically and they say, I don't want surgery. That's not something I want to consider. And it's great that there are so many options, because I feel like a lot of people have been told surgery's your option, right? And they're kind of at the end of the line.
There's not a lot of doctors that practice regenerative medicine. Yeah. We are an insurance-based, surgical-based country, and after you fail all the conservative therapy, if you're one of the 20% where it's either live with it or have surgery, then your only option is have surgery, unless you
Right.
can find somebody that does regenerative medicine.
And so that is what you do. And I know that people can reach out to you. I mean, do you typically do a kind of a consult with them and talk about all their options before they're going down and deciding what's best for them, doctor?
Definitely. I want to know everything that you have tried and done. And if you haven't tried some of the things that I think that can help you conservatively, then I'll tell you, listen, do A, B, and C. Try it out for 2-4 weeks. If you're getting better, just keep going. You don't have to see me anymore.
There you go. That would be the hope, that you don't have to see you anymore, right?
Right.
Exactly.
That's what I love about what I do, is you're only going to see me 2 or 3 times, and you're done. And then I tell you on the 3rd time, I don't need to see you anymore. Refer me somebody.
Right. Then tell all your friends.
Right.
You're all getting
And they
up and
do.
playing pickleball together.
Exactly.
There it is. All right. Well, doctor, thank you for being here.
You're welcome, Robin.